Azubuike has just recovered from kidney transplant he had 2 weeks ago.
I went for tests, they say it's typhoid and malaria. So I started treating, but at a time it persisted, it continued. So I have to go for another test. So when the result came out, I discovered it was I have a kidney problem. So today, the kidney transplant has been done. And here I am. I feel fine. I'm very okay now.
Pastor Clifford, his cousin, donated one of his kidneys and glad to be of help.
I do it because of the occupation as a pastor, to save a soul and to fulfill all the righteousness.
Fadlila was also operated upon on the same day with Azubuike.
December 2 years ago, I realized my legs were just started swelling. So I went to Renal Hospital for medical attention. So from there I was being transferred. I was being given a referred letter to LUTH. So when I got to LUTH, I did some tests that showed the diagnosis that I have kidney transplant, kidney problem.
The patients put on nose and mouth mask for 3 months to minimize exposure to infections.
All patients after transplantation are put on immunosuppressive drugs so that their bodies don't reject what you've just transferred into them. And because they are on immunosuppression, it makes them more prone to infections, particularly from the dust and so on. So usually we advise them to put on the mask when they come, usually for a period of 3 months when they are at home, particularly when they are going to be in contact with outsiders.
This operating table is where kidney transplant recipients are laid while the donors are being operated upon simultaneously in the theater there for the quick transfer of the live kidney to the patient here. The proximity is to promote success of the operation. The causes of kidney failure include infections, diabetes, and hypertension.
The problem is real, and it's because of the increase in the prevalence of hypertension and diabetes worldwide, and Nigeria is not an exception. And the thing with these two conditions is they are not properly managed. First of all, hypertension is silent killer. You don't know you have it unless you check your pressure. It is there in the system and destroying vital organs. It doesn't give you any symptoms. By the time it begins to give symptoms, sometimes it's too late.
LUTH has since joined the vanguard of many hospitals in Nigeria that are doing this on a regular basis. We're building capacity. It's been done in Nigeria, for Nigerians, by Nigerians. It is adding value at much cheaper cost and readily available.
Until recently, patients would have to spend exorbitant amounts to go abroad for treatment. Vivienne, Irikefe, TVC News, Lagos.